Hi, I'm Dr. Federici. For today's Monday Health Tip, I wanted to discuss some women's health issues. Recently, the Women's Preventive Services Initiative recommended that physicians screen all women annually for symptoms of incontinence. The reason for this recommendation is that many women suffer from incontinence and it affects their quality of life. Also, women may be embarrassed or reluctant to bring this topic up, and so it is up to physicians to ask the questions. If we can assess the degree of symptoms, then we can direct treatment. Because there is treatment, it doesn't necessarily have to be something that you just live with. After childbirth and with aging, we can have weakening of the pelvic floor muscles and weakening of the vaginal wall muscles as well. These areas support the bladder. So if we have weakening of the muscles in this area and the bladder is not well supported, this can lead to symptoms of stress incontinence. Stress incontinence means that you have leaking of urine with stress. So with coughing, with sneezing, with laughing too hard, with exercise such as running or with jumping. If you ask most mothers if they can jump on a trampoline with their children without leaking, the answer is no. This affects our quality of life. If we can't exercise as we would like, it affects our quality of life. If we might be embarrassed at work, if we are caught off guard and sneeze too hard and have leaking, this affects our quality of life. So we don't have to suffer in silence. We don't have to accept these symptoms of stress incontinence as our new normal. We don't have to accept sexual dysfunction as a new normal after having children, because many women suffer from this as well and are also embarrassed to discuss it. Having suffered for many years myself from stress incontinence, I was very interested in the new modalities available. I've done pelvic floor physical therapy in the past with good results, but unfortunately I've continued to age. So I brought the Votiva platform to my practice. Votiva uses radiofrequency to tighten both the internal and external vaginal areas. As we tighten these areas, we have better support for the bladder and therefore improved symptoms of stress incontinence. Many women also find benefit from improvement in their sexual dysfunction and just improvement in their sex life in general as we improve the vaginal laxity. So I encourage you to ask questions the next time you're in the office. Ask my staff for testimonials. They have all had the treatment as well, and ask us to see before and after pictures, because those are very enlightening. I hope that you find this helpful, and as always, have a happy Health Tip Monday.